Well, good morning, and thank you for joining me today for our COVID-19 update. So here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 735 additional cases of COVID-19 that have been reported. This brings our statewide total to 125,579 Pennsylvanians who have tested positive for COVID-19 in all 67 counties since the beginning of the pandemic. Tragically, 7,499 deaths have now been attributed to COVID-19 in Pennsylvania. 79% of patients with COVID-19 are now considered recovered. As you know, our teams have been working on a COVID-19 exposure notification app for Pennsylvanians to use to help stop the spread of COVID-19. I am very pleased to announce that we will be able to provide the COVID Alert PA application to Pennsylvanians beginning in September. COVID Alert PA. This app uses Bluetooth technology to let a person know that they have been exposed to COVID-19 without compromising their identity or their location. We have partnered with experts at MIT and the University of Pennsylvania and our app developer, Nearform, to develop a product that will be very easy to use. This innovative solution doesn't replace our case investigators and our over 1,200 contact tracers. It actually enhances their efforts. When someone tests positive, a case investigator reaches out to them to get details about their symptom onset, as well as who they may have come in contact with while they were infectious. Sometimes it is difficult to recount every step in your day and who you may have spent more than 15 minutes with in close contact. And that's where COVID Alert PA comes in. The app will be able to use exposure notification technology developed by Apple and Google to use Bluetooth to measure time and distance, such as any time someone is in close proximity to another person. And remember, close proximity is defined as being within 6 feet for 15 minutes or more. The technology will let other app users know when they have come into close contact with someone who has later tested positive. We want you to know that the entire system is anonymous and the entire system is completely voluntary. It does not really track your travels, but instead uses the same technology that our phones use to communicate with one another. Now, we are very committed and conscious of protecting the privacy and security of all Pennsylvanians. We are working with surrounding states, including Delaware, to ensure that COVID Alert PA works when you are in other states as well. All of our efforts are designed to support our communities to lessen the impact of the contagious virus COVID-19. You can answer the call to stop the spread when you wear a mask. You can answer the call to stop the spread when you avoid large public gatherings. And you can answer the call to stop the spread when you use hand sanitizer and wash your hands frequently. Pennsylvanians want to stay at work, and Pennsylvanian children want to go back to school. But our actions all together as a community impact our ability to do those things. So please adapt your activities to protect against the spread of COVID-19. And please always remember, stay calm, stay alert, and stay safe. And now I'm pleased to answer your questions. Yes?
What percentage of Pennsylvanians will have to adopt the app for it to be effective?
Well, the more the better. And so if it really depends if more and more people in Pennsylvania do the right thing and download the app and when it is made available in September. So yes, the more people who have the app, the more effective it will be in terms of this notification process. So we really call upon everybody to stop the spread, as I've been saying, by downloading the app when it is available in September. Yes?
Just like masks, a lot of people don't buy in at first. What kind of marketing tools will you be using to encourage Pennsylvanians to use this technology?
Yes, we will be having a specific marketing campaign, so to speak, to be able to encourage people to download the app, to reassure them that they're not being tracked, that this is totally anonymous, and it doesn't really track where you are, and to really answer any questions that they have. So there will be a specific campaign coming out to advance this app. Yes?
My question's not exactly on the app.
Okay.
But yesterday, the guidance came out from the health department to school districts to require or to order students to wear masks in addition to the social distancing. And I'm hearing from school officials that, okay, this is like another last minute guidance or order that they have to comply with. And they're wondering, why this change? Why so late? Why so close to the start?
Sure. It really is just a clarification of the information that we put out for schools in July. So we put out schools information about social distancing, about being 6 feet apart, and as I've said numerous times, 6 feet actually means 6 feet, and that students should wear masks. But what we have heard is that some of the language wasn't as clear as it could be, and so we wanted to make sure that we were as clear as possible, and so that was sort of the evolution of this came out. It's really nothing new. It's not different than what I've been talking about for months and months, is that everybody should wear a mask when they're in public, and that, of course, includes children in school. And so that's why we put it out yesterday, to make sure that we were crystal clear. Yes?
PIAA Oversight Committee is meeting top of the hour about returning to sports. Again, the vote's going to be on Friday. Do you have any additional guidance for them as they go into that oversight committee and then the potential return to sports?
Sure. The recommendation from the governor and myself is that all school sports be postponed till January 1st. And that would include school sports, but also recreational and club sports. So I think the governor has been very clear about this recommendation, and we have been consistent in terms of how we're describing it, and that continues to be our recommendation. I think it's really important to take the same lessons about COVID-19 that Penn State took, that the Big Ten took, that the Pac-12 took, and that school sports be postponed as well as recreational sports until January 1st.
If the PIAA votes on Friday to move forward with the return to sports in the fall, is Department of Health and the governor prepared to take a next step to potentially codify an order to put that on hold till January of 21?
The governor has been very clear about that. There are no plans to do that. Yes.
Going back to the data that you guys used to make that decision, it
Sure.
received a lot of criticism because it seemed like there was little to no Pennsylvania data used in that decision, more national. I know you cited like something that happened in Georgia. Why was using national data part of that decision?
Well, school sports haven't started. School is just starting this week. So I can't use data from sports that haven't officially started. So we were using some data from other states, and children in other states are really no different than children here. And so our recommendation was based upon that. We have seen, though, a significant increase in the number of young people less than 19 that have COVID-19 in Pennsylvania, in almost all regions of Pennsylvania. We have seen that. We're not able to track it through our case investigations to like a specific game or I guess a specific practice, but we have seen an increase, and we're concerned about that. We also now have 43 cases of the very severe pediatric illness MIS-C, which is multi-system inflammatory syndrome of children. So 43 children that have been hospitalized throughout Pennsylvania, more in the southeast. There are 19 cases still under investigation with children with that severe illness. So the idea that children don't get COVID-19 is incorrect, and the idea that children can't get very sick from COVID-19 is incorrect. They can. They get tend to get less sick in proportion than seniors do, but they can get very sick. And it is absolutely not worth the risk in terms of sports for our children. The other factor is, of course, that it's not just within a school district or within a county. If you're going to have a PIAA sports, then they're going to be traveling, sometimes 2 or more hours. They're going to be on buses all together. They're going to be then interacting with young people in other counties that might have different rates in terms of the prevalence of COVID-19, and maybe there are different outbreaks in counties. And so that mixing is really counterproductive and could lead to more spread of COVID-19. I mean, the PIAA admits in their guidance that they put out that there are some particular sports that are quote-unquote high risk. And so we'll use football as an example, but it's not the only one. And so, same guidance that the Penn State and the Big Ten have made, and that's our recommendation. Yes?
So I know that your agency has been sending letters to people who have been exposed to COVID-19, telling them about the responsibility to quarantine. Will Pennsylvania use this app to enforce quarantine or figure out if people are not complying with quarantine recommendations or orders?
So that's not what the app does. So, and we'll be not using the app to enforce quarantines. So if someone is positive with COVID-19, they have to isolate, and then close contacts would quarantine, as you were saying. We do have the legal authority to mandate isolation and quarantine, but we are finding that most people will do the right thing, and if they have COVID-19, they will isolate, and if they get notified that they have been exposed, that they will quarantine. This app doesn't have anything to do in terms of that legality.
Okay, and so who's really managing the data here and the general the product of the app? Is it happening in the Department of Health? Is it researchers from MIT? Is there an outside firm that's managing that?
Well, so there is
all the information going to live, and who's
Sure.
going to have oversight over it?
Well, I mean, there is that the company Nearform that will be working with us. I actually will have to get back to you in terms of the computer system where the information lives. So a lot of the specific technology, we can get you that information. I think it's a really good question, and so Nate can talk to our team and get you some of those specifics about the technology of it. Yeah.
If I can circle back to my question about
Sure.
Okay. Well, it seems like, earlier school districts did receive some guidance about breaks from the wearing the mask during the school day, eating or drinking when they're spaced 6 feet apart, seated at desks that are at least 6 feet apart. So now you're saying even when they are sitting 6 feet apart, they have to wear a mask. So, I mean,
That is correct.
So you're saying that this advice now, this guidance now is clarifying what was before, but it seems like it's not just clarifying, it's changing.
From our perspective, this is what we meant all along. And so we understand that the original language was unclear about students at their desk. And so we have had questions about it, and we've had enough questions that we wanted to clarify. That we mean that when the young people are wearing masks, that they are wearing masks. That they're in their classroom, even though they're 6 feet apart, they should be wearing their masks. And so we wanted to make sure that our advice was crystal clear, and so we put out the guidance.
And are you allowing mask breaks still, or?
There are allowances for mask breaks. They'll need to be at least 6 feet apart, preferably more, and the schools will have to kind of work that out. So mask breaks are part of the new guidance, but not basically just sitting at your desk. We want the young people to be wearing masks. We understood how the previous guidance was not as clear as it could be about that, so we clarified it. Yes?
Going back to the app now.
Yeah.
You said it would not be replacing physical contact tracers. How will the app work, I guess, to complement the work that they do?
Well, because it notifies people. So, if you have been in Philadelphia and you were walking about and you went to, get some takeout, and then you went to CVS or, a drugstore, and then you might not know all the people that you were within 6 feet for. Say you were waiting in line for a little while, you might not know. And so when our contact tracers call you, you might not be able to say, or you might not know who that person is, right? If you're in a town or a city, you don't know everybody. And so this app will help us be able to, those individuals to know that, they were within within 6 feet for 15 minutes, and they are considered a close contact, and they should quarantine. Otherwise, we might not be able to do that. So it's really going to enhance the work of the case investigators and the contact tracers. It does not replace that in any way. Yes?
So will your agency be able to analyze the location data on this app and like determine where people, the way that they're able to analyze contact tracing data now and determine, all right, are people who have exposure, are they visiting bars? Like, will this data inform public health decisions, like stay-at-home orders?
It really doesn't enable the location services, so I believe not. But again, in terms of that, some of those technical questions, we're going to get back to you. I think they're really good questions, and I want to make sure that you get exactly the correct answer from our technical team, so we'll get that to you.
Okay. I guess just to clarify, so when you're saying that it'll be able to determine like people's proximity to each other, but it
Yes.
won't be able to determine their specific location?
It's not going to store their specific location. I know that people are concerned about that, that the government is somehow tracking their location. It does not do that. But it will register because of the way that, and again, I don't know that, I can't tell you the technical data, that you were within 6 feet of someone for 15 minutes or more, thus you are a close contact. It's not going to say that that was on a specific block in Philadelphia,
Okay.
because then you're tracking their location. So it doesn't do that.
So, but I mean, maybe it won't tell you that, but will it somehow register that? Like, I feel
No.
like it must have to use some kind of geolocating software to determine like how. close
Yeah,
you
again, you are asking questions that we're going to get back to you about those technical issues, but I don't have the specific information to give you, but they're really good questions. Yeah. Yeah.
The National Association of County and City Health Officials estimate the need for 30 contact tracers per 100,000. And I was just wondering, that figures out to about 3,800 some for Pennsylvania. Does the health department agree with that estimate, or just?
It's very approximate, but yes. And so we have talked all along that we were going to have well over 3,000, up to 4,500. We'll see what number we get to. So we're very pleased to announce yesterday that we have now over 1,205 contact tracers, and we're working our way towards those goals that you discussed.
And since so many people, and the data that you released last week, that people just don't talk to these contact tracers, is it worth the investment?
Yes. So, but we want to make sure that people do answer the phone and respond to case investigators and do respond to the contact tracers, and that's how we're going to be able to protect the public health, and that's all part of our containment strategy. In terms of containment, you increase testing. We have well over 22,000 test reports per day that we're getting. We want to increase that even more, hopefully with new technology of tests that were talked about last week, and we've heard some new tests coming out from the federal government in the last week or so. If someone is positive through those tests, that's when our case investigators come in, and we're hiring more case investigators. And then those people isolate. We find out who the contacts were, and then they are contacted by our now over 1,200, but eventually over 3,000 contact tracers, and they're told to quarantine. This app will be one part of that process, as we've been describing, and one piece of the puzzle to help contain the spread. And of course, we're working always very closely with our county municipal health department partners where in their locations they have leads. So Philadelphia, Allegheny County, Erie County, and we're all going to be working together. Yeah.
How much is this project costing? The development of the app, the deployment, and how did you choose near form and stuff?
I don't have the figure in front of me, but we can get that to you. Yeah.
Dr. Levine, what's your greatest concern with the return to school, with all of the guidance and all the mandates that are out there? What's your greatest concern?
Well, my greatest concern is that there is spread of COVID-19. So we are watching very closely what's happening in other states and other parts of the country. We need schools to make sure that young people are social distancing and wearing masks. In Georgia, there were a number of different schools where clearly that didn't happen, and so there have been outbreaks in those schools. Those schools are now virtual. And so for schools that are bringing kids back to the classroom or having some type of blended classroom, but where some kids are back, it is critically important that they follow the same guidelines that I talk about every day. Masks, social distancing, hand washing, hand sanitizer, and that the young people, work with the schools and the school personnel about that to protect the teachers, to protect the staff, and to protect our young people. Of course, young people go home to parents who are older, and then sometimes see grandparents who are older. And so it is very clear that young people can spread this virus, and we want to protect against anybody getting sick, but particularly outbreaks. And so that's my biggest concern.
In case of an outbreak like University of North Carolina, Chapel Hill, 135 or so cases, then they went to virtual learning at Chapel Hill. Do you see that potentially happening in Pennsylvania if an outbreak occurs?
Well, so we put out guidance last week exactly what happens if there's positive cases. So we're very specific in terms if you have one positive case, if you have more, whether it's a young person or a teacher. So we have given guidance. I think that, having a school have to go virtual for a period of time is possible anywhere in the United States if there's an outbreak. And so we have put out that guidance last week. Yeah.
So I've heard reports of people who are asymptomatic and trying to get tests being unable to get tests right now, including like through Rite Aid. Is that is it still the case, as you said a couple weeks ago, that anyone who needs a test in Pennsylvania or who wants a test can get one, or what's affecting the different availability and testing right now?
Well, it's critical to prioritize prioritize testing, and certainly the priority would be anybody who has any type of symptoms. So it doesn't have to be a very high fever or very ill. You don't have to go to the emergency department or the hospital. We want anybody to be able to get a test, but we are prioritizing diagnostic testing for symptomatic individuals. And we're not doing at this time. We do not have the ability to do widespread population-based testing of asymptomatic individuals. So we would prioritize those that are symptomatic. Where we have done population testing is in nursing homes. And so we have tested every patient and every staff member. We're working on our retesting protocols for that, and we've heard that the federal government will have some recommendations coming up about that, especially using the new point-of-care antigen tests that they're going to be sending to nursing homes. So we're going to be working to incorporate that into our systems. They're not really available yet, but they will be. And so that will be in advance, but there are questions that come up. How do we get those results from all of those antigen tests, et cetera, since they're point of care? So lots of questions that we have to work out. We are working on finishing all of the testing of every patient and every staff member in all of the other long-term care facilities that are regulated by the Department of Human Services. And I know they're working very hard to have that completed by the end of August, and then all those retesting protocols. So that's the population-based testing that we're emphasizing. So we would prioritize tests to people who have symptoms or some particular reason why they might have COVID-19 as opposed to testing the whole population.
I guess, when the last time I was here a few weeks ago, you did say that anyone who needs a test in Pennsylvania can get one now. So I'm just curious about what are the demands? Are you seeing increased demand for testing? Are we seeing more symptomatic people who maybe aren't reflected in our case counts because our case counts have been kind of steady? I guess I'm just kind of trying to understand what's changed.
Well, what has been changing are the delay times, right? So that there are some of the delay times in the last week or so, and I think we talked about this last week, are better. So we have heard from Quest that they are down to 2 days. We've heard from LabCorp that they're down to an average of about 2 days. That's much better because in some of those tests have been 5-7 days or longer to get results. Now that's average, but we've heard that they're all doing much better. But there have been challenges in terms of getting test results. Remember, Pennsylvania is not an island, and so we in some ways almost competing with other states for that access to getting those tests done. And many other states have been much more severely affected than Pennsylvania has. In addition, the hospitals particularly are having difficulty getting the reagents and the chemicals for some of their bigger platforms, particularly the Hologic Panther and the Roche platform, and there are international shortages of those. So, if there's some challenges getting, then we have to prioritize testing. And so the priority is anybody who's in any way symptomatic or with COVID-19 versus someone who wants a test just because they'd like a test. And now when we have the OraSure test that was discussed last week, that DCNR has been has a grant for, and we can have point of care testing that you could buy at a drugstore, then that would be great. And then if we have enough of those, then anybody can get a test anytime they want. But we have to do some prioritization because of national shortages.
Basically, you're saying that they're slowing down the rate at which they're administering tests so they can process them more quickly. Like, so that we don't have backlogs, because we have on the.
They have expanded their capacity. So Quest and LabCorp have expanded it, but it's not infinite. And there are significant outbreaks from other states, and now some outbreaks in schools and some outbreaks at University of North Carolina and things. All that uses up testing capacity in the country, and we are competing with other states for access to test results quickly, and also access to those reagents, particularly for the hospital and health system platforms. And so we want to make sure that we prioritize testing so that we're using it, a potentially limited resource, really carefully.
You mentioned the guidance for the schools of when schools should shut down
Yeah.
and this is what they should do. Does that apply to colleges?
So those guidances were particularly through K through 12. So all of our guidances have been specifically through K through 12. The colleges have they've all developed their own plans. They're welcome to be looking at ours, and we will be networking with colleges, but they've been really required to and have developed all of their own plans for return to school. I think the key is going to be, I think some of the plans are great, but I think it's going to be the compliance with the plans, as we saw at University of North Carolina and some other colleges. So if young people are having very large parties, they're not social distancing, they're not wearing masks, and they're not washing their hands, you are going to have spread of COVID-19. It is clearly still here. There is still community transmission in the United States and in Pennsylvania. And so the compliance with these very detailed plans will be the key. And in the end, it really comes down to what I talk about every day.